Hello, everyone. It's Dr. James Marcum with another biblical prescription for life. Thank you so much for spending some time with me. I have something to share with you. Today, I want to talk about the World Health Organization and also why heart attacks might be increasing. So those are our topics today, but I want to start first in Psalm 6, verse 2. Have mercy on me, O Lord, for I am weak. O Lord, heal me, for my bones are troubled. Wow, that might describe many of us. Being weak, in the need of healing, having trouble in the bones. That also might describe the nation that we're under, but thankfully, hopefully we're doing something about this, at least individually. We can pray. We can encourage our government to do the right things. And I'm glad to report that the World Health Organization has had a little bit of a setback in their policy making. And this was by Robert F. Kennedy Jr. And as you know, he's director of the Health and Human Services, and he's trying to make America healthy again. His first focus has been on chronic disease, helping our children do better. He's identified some of the problems. He's trying to move some of the chemicals out. And now he's gone up against the World Health Organization, who wanted to make some regulations. Does that surprise you? They wanted to be able to unilaterally declare health emergencies. So they would declare emergency if they thought there was a health emergency. They also wanted to enforce global narratives. So they would enforce the global narratives, what people promoted, but they also wanted to squash misinformation or what they deemed was misinformation. And finally, the World Health Organization also wanted to create frameworks to basically do biomedical surveillance. They wanted to enforce digital vaccines, digital passports. They also wanted to make it difficult to cross borders. So they wanted to have the authority unilaterally to do all these things. Well, I am glad that the Health and Human Services and RFK Jr. has rejected this regulatory body. This should take the winds out of some of their sails. The bottom line was the government, our country, we can decide these things on our own. We don't need another organization telling us what to do. So I thought that was very important. But you might ask, well, the World Health Organization, RFK Jr., why are you putting this with heart attacks? Well, recently, the data shows that heart attacks are increasing. Most people understand that heart attacks are when the heart, through the coronary arteries, don't get enough blood, the heart muscle dies, bad things happen. There's many different types of heart attacks. There's a heart attacks where you have a small plaque that ruptures. There's a type of heart attack that gradually has more and more plaques, and that occludes the arteries. Usually they have symptoms before. The plaque ruptures can come from nowhere. Then there's the types of heart attacks where the artery spasms. It closes completely, no blockages, it spasms, then opens up. Sometimes an artery might have a tear in it, causing a heart attack. That's called a dissection. We call that SCAD, a sudden cardiac arterial dissection. Sometimes this is rare, but sometimes a foreign body, a clot, can float into the coronary artery, causing a heart attack. And then sometimes you can have what we call a broken heart syndrome. So much stress, anxiety, usually after the loss of a loved one or a sudden physical, emotional trauma. There's so much stress. You make all these stress chemicals, adrenaline and cortisol, and that can simulate a heart attack. Well, there's many different types of heart attacks, but we're also seeing this article from King County, Washington. Now, King County, Washington, that's in the Seattle area. They've been known for years to be the best EMS program. If someone was down in the field, they could initiate CPR, they could shock the patient, get them to the heart hospital quickly where that patient could have a procedure and save lives. And they have recently found that from 2001 to 2020, they found out that the survival after a cardiac arrest to discharge from the hospital during those period of time, almost 20 years to 2020, rose. So it rose from 14.7 to 18.9% of those who survived were actually discharged from hospital. So they improved survival those 20 years. And if they were able to find a rhythm in the field that they could shock, remember, you don't know how long the person's been down in the field. If they had a rhythm that they could shock, the survival rate over those 20 years went up from 35 to 45.7% survived from the hospital. And we've attributed that to improved care that we give to heart attacks. They're identified quicker. People are educated, calling for help. We have defibrillators in the field. More people are trained from CPR. The EMS knows what to do. They're getting them to the hospital quick. The cardiologists and ER staff are notified, getting them to the cath lab, figuring out what type of heart attack they have and what type of treatment to deliver fast. So we've improved acute care in cardiac MIs quite a bit. But unfortunately, a 2024 study in the Journal of Emergency Medicine showed that cardiac arrest survival has declined quite a bit. In fact, the cardiac arrest survival from fatal events actually increased. Here's some pictures of this. It increased by over 1,200% during the COVID-19 pandemic and injection periods. The number of lives actually lost to cardiac arrest in King County in just 1 year during the peak of COVID and the mRNA injections was nearly double the lives we spent 2 decades working to save. The spike protein from the mRNA vaccine was not good. Then, in this study recently that looked at the vaccine-injured people, all of them had symptoms of some sort. The vaccine injured from the mRNA vaccine had a 7 times higher spike antibody than unvaccinated with confirmed infection and long COVID. So they have a lot of spike protein in the body. Spike protein is not good. Spike protein can damage the endothelium. When the endothelium is damaged, more likely to form a heart attack. Many people are still getting the COVID mRNA vaccines. Many people are still receiving spike protein. There's some concern that our bodies of some people are making spike protein. We definitely need a test where we can easily not only measure antibodies, but can measure spike protein directly. We need this. And agencies like the World Health Organization, who are saying that we have to unilaterally declare health emergencies, enforce global narratives, and squash misinformation, and create frameworks to surveillance disease and make policy and not look at something as simple as measuring spike protein. They don't even talk about what they really should be talking about. So I'm glad we're moving away from them, at least from heart attacks. But there is some good news despite the increasing rates of heart attacks. And there is the good news that we turn these down, but also just recently, Thomas Massie introduced a bill to repeal the PrEP Act. So all of those who've been hurt by the vaccine, by some of the policies that have been made, all those have been hurt that might have these mRNA-induced problems long-term, they have some recourse. They're voting to repeal the PrEP Act. Now, the PrEP Act is an act passed in 2005. Basically, it protects those who make vaccines from liability from their product. So if lots of people are hurt by a product, they really can't go anywhere to get help. They can't seek for liability. They really can't do anything. Masses of people out there that I hear from are looking for support. Many people have said that this PrEP Act is a good idea. Thomas Massie needs support because this bill would help restore trust in some of the policies and precedences that we've had problems with over the last few years. So in summary, the World Health Organization, RFK, rejected some of their policies that were seeking to have control. I think that's is great because control isn't so good for the things that we need, which is we need to measure directly the spike protein in the blood. We need to consider whether the mRNA is safe for anyone anymore based on this heart attack data going up, this continued study that shows we have higher spike antibodies in our mRNA vaccines. And now we've also had warnings the FDA put that these mRNA vaccine, especially in young people, get repeated dose, can cause myocardial damage, including myocarditis. Remember, heart attacks, many are caused by damage to that endothelial lining. We need to protect that endothelial lining from antigens, foreign projects, dangerous stress inputs that trigger inflammation and perhaps plaque rupture, triggering a heart attack. That's why we see the best emergency room in the county go crazy with results. So I'm Dr. James Marcum, wishing you the best of health. Join me, like me, put your comments below.